Okay, my name is Caleb Liggett. I'm going to talk about growth stimulation of long bones when there's a fracture or a similar trauma. About the 19th century, many scientists found that the long bone will stop when it has a fracture, it'll stop growth or a similar trauma. The degrees of growth increase at these fractures that could be thought to disclose whether the localization of the fracture in relation to proximal and distal epiphyses. The materials and methods they used, and we're talking about, were humerus fractures, mainly in children because the growth plate stops when you get into adult years. In 1937, Milwee came up with a technique called the slit scanography, which pretty much just measured the growth of the whole humerus to see if the length got any longer or shorter due to a fracture or a similar trauma. It had a curtain brace falling at right angles to the film was then obtained. Some results from this clinical trial was the average final overgrowth for the 7 cases of dislocation grade +2 is 7.4 millimeters. All these measurements being millimeters. That's just how they did it. But the patient with a dislocation grade +1 had an average growth of 5 millimeters. So the results were not really the best, and you couldn't really tell a growth increase or a growth shortage. This picture just shows the 3 different types of fractures on the humerus. Fractures through the supracondylar zone, which is right here, and the fractures through the diaphysis, which is right here, and then some fractures through the surgical neck, which is right here. And this is just the method they used that's called the slit scanography. And then this chart is the average outgrowth in millimeters during consecutive time intervals in the humerus. And for the discussion, it can be established that 70 out of the 86 cases in the material showed such an increase in growth. A measurable difference in bone length after a fracture and growing long bone cannot be inspected in every instance.